Hello everyone, OT Lifehacker here with more acute care resources. I am so happy to see that this is helping you guys out. I love the messages you are sending me. Thank you to all of you who reach out and let me know how much this helps you. So really glad to hear that. And what we have today is potentially familiar to some of you. So this is the templates that I made inspired by my supervisor for acute care fieldwork at the time, who had suggested to make myself a notes that are structured based on the electronic documentation that we need to do. So that way I know what to record. So here I'm going to show you 3 different versions. And there's 3 different versions because I graded my own self, meaning started off with a less challenge and then up the challenge. So for each patient I had one sheet each, and that's because I made it so that I can get all the information from the electronic documents that I need to gather and make sure that when I see the patient and do my chart reviewing as well as the occupational profile when I do the assessment, and then when I do the documentation, everything that I need is there because I am training myself, I'm practicing by making sure I record everything that is needed. So that way I don't have to go back and forth into the patient's room. That really reduces efficiency, so we don't want that. So here's the first sheet. This is what you're seeing right here. It's a comprehensive sheet. I indicate treatment time because you'll need that for billing. And again, I also want to point out that this can be different in each acute care setting. You may have different, different electronic document systems or different documentation systems in general, different billing systems. And so customize the sheet to what is being asked of you for your acute care. And yes, you guys know this resource, all my resources that I show are available. I will put it in the description box below, the links to this. So please find it there, and it will be all 3 that I show you. Okay, so for my field work, I needed to indicate the patient name, the room, age, weight, all of this that you're seeing. The hemoglobin, potassium, because again, remember how I said that it was very important, the lab values. These were the 2 that I particularly needed to pay attention to. So I really needed to make sure that I documented it for myself and able to report that to my supervisor. Now, if when I say the lab values that I talked about, if that's not ringing a bell for you guys, find it in the description box below, the videos to that, because I do have videos on acute care lab values. And then you'll need to know the diagnosis, the past medical history, and admission, because again, diagnosis and past medical history can also lend to the lab values and why they're not very stable, and the facts that you may need to be looking out for certain complications. And of course, you need to know why they're in the hospital, right? Next, we have precautions, because you need to know, is there orthopedic precautions? Is there spinal, cervical, neuro precautions, fall precautions? What do you have to pay attention to? Are there special alerts or bedside equipment that you need to pay attention to? And what the patient states, so this would be the occupational profile, so that you have what is it called? Your subjective for what the patient tells you. And then sensory impairments, are there any? Do you have to pay attention to hearing? Do you have to speak louder on one side of the ear, or do you have to use other means? Visual, do you have to adjust that? Do you have to adjust speech? So definitely things to consider and things you may need to also document on, which I did need to. And then this as well, this was in our documentation listed. I think it was listed just like this, and it's again for the safety, basic commands, problem solving. So it's indicating, are these things that they have, are they safe? Do they have the basic command following? Like, do they follow directions? Are they able to problem solve? So you're looking at their cognition. And there's also the O times A, so you will need to know the orientation and alertness and the level to which they are, and the questions to ask, like when were you, like date of birth, or where are you right now, what happened, all of those. And then prior level of functioning, so what they were like at home. Did they have stairs at home? Did someone help take care of them? Because you want to get them back to their baseline, not to the optimal. So keep in mind, there's a difference between baseline and optimal. Baseline is what their prior level of functioning was. So if they had someone who helped them, if they were in a nursing home before, then that's where you're getting them back to, nursing home. You're not making them so that they can have a miracle where they can do everything on their own again in just a few days. No, your purpose is to get them back to the prior level of functioning, back to where they were before, the amount of help they had before, if any. And then current level of functioning, so that you can make the comparison. And then the modified ranking scale. That's something you might want to look up. And then discharge plan. So modified ranking scale for us was a measure that we used to help with the discharge. And then discharge is where you would recommend them go to: nursing home, acute care rehab, home health, and then home and environment. So this is similar to prior level functioning in that it, well, actually I shouldn't say it's similar. So this is slightly different because it's going over what their home was like. If they have steps, did they live with anyone, the bathroom equipment, any adaptive equipment they had. Prior level functioning indicated like min assist, independent, and things, because again you're looking at what was their ability functioning back in their previous setting. And then current home treatments or professional skilled services they receive. And then prior level functioning goes more in depth. Here is the ADL, mobility, household activities. So I put all of this because in case I forget to, or like I draw a blank and I'm in my very first on my own patient encounter, I'm like, what is PLOF? And what am I supposed to put for that? And then I have this to help me out, where it's like, talk about ADL. Did they have any activities of daily living that they did on their own? And if so, to how much level? And mobility, talk about what they use. Do they use any devices? Household activities. What was important to them, for them to do at home? And then, did they have any assistance with house management, financial management, all of that? Did they own any adaptive equipment? Their gait and primary devices they use. And then the mental status. So I did talk about this. I talked a little too soon. So referring back to this, the A times O, alertness and orientation. So this is looking at the self, person, place, situation, time, and any behaviors you observe, because it might be different. I mean, there may be other things you observe besides just the information you gather from the questions you asked, because sometimes things may not match up. And then their thought process, are they coherent or are they confused, disjointed in their thoughts, illogical, irrelevant with topics, rapid, do they go off topic, safety awareness, is it impaired, and if so, due to what reason. Cognition, look at the impairments in all of the following, and of course, try to test for them. Pain, where is it, and rate it, 1 to 10, or whatever the scale you use. And then going into the ADL, and then mobility. And I'm not going over each one of these now because we basically did on this section when I talked about ADL mobility. This, again, as I told you, I'm going into more depth on the ADL mobility. Basically, it's a checklist for myself. So ADL, mobility, and then the range of motion, looking at that. Are they left-handed, right-handed? And then what is their right upper body extremity strength? What is their left upper extremity strength? The range of motion. And then the goals. So OT problems and goals. and then their level of teaching readiness and education. So notice how you're like, oh my gosh, that's a lot. So yes, you don't have to get it perfect the first time, but this was meant to help me to get to record everything, because there's so much that you need to document on, especially when you're doing your assessments and you're like, I don't even know where to start. So this can be a good guide for you to know, like, okay, for the chart review, I gotta get their name, of course, the room number, the age, lab values, diagnosis, all of this. And then when I ask them questions, and even in the chart review, I look for home environment, the type, and I look for the prior level of functioning. Okay, prior level of functioning, I need to look at all of these. Okay, then for all of those, that's what I'm looking at. I'm looking at their feeding, grooming, bathing, dressing, toileting, endurance. This is all stuff we look at in acute care. And then I also need to make sure, what is their, like, what are some other factors? What's their mental status, alertness? Are they safe? Or what's their thought process like? So a lot of things that you need to consider. That's why I made myself this, so that it would be helpful. And as the weeks went on, I challenged myself to really get it into my working memory and have it become habitual where I know these things. And so then I made myself an even shortened version, because you don't want to become reliant on your paper, because you don't want to be looking at just your paper. You use it as a checklist. So now we have it, as you see, modified, simplified, and here we have the treatment time, reason for admission, diagnosis, and then prior medical history, precautions, and special alerts, bedside equipment. So that is important to know. If there is some bedside equipment like the catheter or PICC line or the feeding tube, all of that, because you're going to have to be prepared when you go into the room. You have to know, you got to take care of all of that. And then recent medical information, any consults, testing, findings from the testing. And then that was the modified, right? Now, as the weeks went further, and I was like, I got this. I'm getting much better at this. I made it so I can have them all on one sheet. So here we go. It's all on one sheet. And this is the crux of everything that I really needed. So room, age, year, weight, hemoglobin, potassium, their name, diagnosis, precaution, and then consult, because we want to know who is involved in their care. And then you can also add yourself the notes. So it's more open-ended for you to add what happened in the session, their prior level of functioning, current level of functioning, any equipment they have, and all of that. So I hope you find this helpful. And again, you will have access to these resources, and you modify them as you feel fit. I will have them available in the description box, as I mentioned before. And again, they are completely free. If you want these resources and use them, please, it's super helpful if you can like and subscribe and share the videos, because then others can find it. And I truly appreciate all of your support, guys. Thank you so much. Bye.